Hi, good afternoon. I'm Dr. Paul Pipia. I thank you for the opportunity to speak. I'm the chair of the Department of Physical Medicine at Nassau University Medical Center, and I am president-elect of the New York State Medical Society. The governor's proposed budget contains a number of measures we support to enhance physician-delivered care to our patients, but it also contains concerning items that will adversely affect inpatient care. With our testimony has been submitted. We thank the governor for proposing to continue a number of important programs. The MSSNY Committee for Physician Health, which absolutely is an essential program to help address the growing problem of physician burnout. The Excess Medical Malpractice Insurance Program, which provides nearly 16,000 physicians with supplemental layer of liability insurance coverage, which otherwise would be unaffordable in New York's excessive high-cost environment. Proposals to help ensure access to care in underserved areas, including the Doctors Across New York Medical Student Loan Repayment Program, and proposals to increase the reimbursement for care received by patients insured by Medicaid and the Essential Plan. However, we oppose some of the proposed burdensome new prior authorization requirements on physicians writing prescriptions for their patients insured by the state's Medicaid program. Physicians and their staff are already drowning in excess paperwork and phone calls and are taking time away from patient care. We are also very concerned with the proposal to require the DOH approval for private physician practices who wish to merge with other practices, which will reduce patient choice in a care setting and prevent innovative ways from expanding quality care to delivery. However, most importantly, we strongly oppose Part W, which would fundamentally restructure New York's healthcare delivery system by significantly expanding the scope of care of healthcare services delivered by PAs, pharmacists, and others. We are deeply concerned these proposals would adversely impact patient care by completely removing the important oversight and coordination that a physician provides, particularly as it relates to the ordering of diagnostic tests and evaluation of effective services. With regard to proposal to prevent physician's assistants to practice independently after 8,000 hours of care, my residency was 16,000 hours, but merely accumulating hours did not make me a physician. I had to achieve milestones, which were set and constantly modified by national certifying boards that oversees residency training programs. I also had to pass a certifying exam, and every 10 years must complete continuing certification to maintain my board status. These standards are crucial to ensure patients receive the best possible care and should not be overlooked. Thank you.
Thank you. Next, Helen.
We're having physician assistants, when we're having pharmacists that are actually pharmacists that are writing orders, for example, for prescription medications, when we have nurse practitioners, for example, that are authorizing tests, as has been proposed in some legislation that's before this the state legislature. What problems does that create?
Okay, so nothing stops any of these individuals to quit their profession and go to medical school, okay? They're also very valuable, and it's in my testimony, a very valuable integral part of the the healthcare team. They provide essential services, so I'm not saying anything tremendously bad about them, but at the end of the day, there should be somebody who's a physician that should be heading the healthcare team, and that's our position. We think that person should be the physician. Just accumulating hours, as I said earlier, doesn't make somebody competent in their field.
Are you aware of any studies? I read about the South Mississippi Systems Accountable Care Organization.
Right, so there was a study that was done by the AMA, I think it's referenced in our testimony, that says that those people as physician assistants and possibly nurse care providers order more tests than the physicians do. And that's a study that was done by the AMA.
Thank you.
Assemblyman Ra.
Thank you. Dr. Pipia, also about that kind of same topic with Part W, do you have suggestions, and I think you do, because I think we've spoken about this in the past, but about other things that the state could be doing as opposed to scope of practice changes for non-physicians to help address shortages of people, of doctors in certain specialties in parts of the state.
So among the many things is New York, and it's in our testimony in this charts, we're the highest malpractice cost in the country, okay? If you look at Texas, it might be like 2.46. In New York State, it's like 24. So it's like, 12 times what another big state pays. So if that could be lowered down, if there were medical courts for that type of stuff, it would be good. Also, the Doctors Across New York is a program that's funded. We probably could, find another way to let other people know that exists and help make sure that program gets more utilized. And then also, there's a lot of burdens in this state that are negative towards physicians. A lot of things. I mean, Medicaid pays us much lower than the Medicare ceiling, and now you're going to have to make a call and task somebody to call up and get a pre-authorization on a medication. So New York is not the most friendly environment for physicians to work, and people are leaving New York quite frequently.
Thank you. And just
Thank you, Madam Chair. I want to thank the panel for your patience today and testifying. I just have a question for Dr. Pipia, which actually Assemblymember Ross started asking you about it. I think one of your responses was New York State makes it too difficult to be a doctor, and therefore we don't have enough doctors.
All right, so let me clarify what I mean by that. The standards are the same in every state. However, the amount of hoops and loops and hurdles
And paperwork.
and
You don't like the
paperwork and all
paperwork.
of that kind of things, yes. I mean, like,
Yeah.
to get approval for something, I have to call up, and I'm the physician, and somebody else who's
Well,
not a physician
I
making the
understand.
decision.
I understand it's a pain in the neck. Dr. Pipia, I tend to agree with you. I mean, you go to medical school, you spend a huge amount of your life studying to become a physician, and physicians are highly skilled, highly qualified, and we don't want to take anything away from them. So I tend to agree with your statements and your written testimony, but we are approached over and over and over again by nurse practitioners and other participants in the medical field about expanding their scope of practice, and one of the main reasons that they offer, which I have always found it hard to refute, is that there are lots of communities where physicians are not available. And you cite the difficulty or the hassle or paperwork of being a doctor in the state of New York. I don't think there are any shortages of doctors in the New York metropolitan area, but there are parts of the state where it's much more difficult. So in order to make sure that those fellow New Yorkers have adequate care, to the extent that physicians just are not available for whatever reason, don't we need to deliver the care in some other manner?
Okay, so you're right when it comes to that. The thing is this, we're asking for a physician to be oversight on them. In preparation for this testimony, I had a PA that worked for us when I was in Brooklyn and downstate, and this was the best PA I ever saw in my life. He decided to become a physician. He quit. He went and became a physician. I called him up and I go, can PAs practice independently? And this is one person's opinion, obviously. He said, I learned so much more in medical school to help synthesize what I did when I made a care plan. So I think that's the way to do that. And for those of you who are lawyers, and this might not be the best analogy, but you have paralegals that work for you. Are you going to let paralegals go to court and do cases? And the answer is probably not.
And likewise, a mother
Right.
who's looking for health care for her child may not be so inclined to go to a nurse practitioner or a physician assistant, not to take anything away from them, but if there are no doctors available.
They're an essential group. I kid you not, they're an essential group, and we value them, and they're part of the allied health team, but we just think that the doctor should be the one that's in charge of all of that stuff. You can't have five different people driving the car at the same time.
Thank you very much. Thank you, Madam Chair.
Thank you. I believe the Assembly is